Hi, I'm Dr. Hale. Today I'm going to talk about dry needling for the treatment of chronic heel pain. There's an article from Italy showing dry needling has a 95% success rate in patients who are unresponsive to standard medical therapy for plantar fasciitis. First, we're going to talk about the technique of dry needling. We use an ultrasound machine to guide the needle placement. This is the ultrasound probe. We use the ultrasound to mark out the interface between the plantar fascia and the heel bone. This is an image from an ultrasound machine. We're looking at the bottom of the foot. The patient's toes are to the right. This is the bottom of the heel. The plantar fascia is here. This is what we're looking for, the plantar fascia bone interface. First, we're going to use local anesthetic. The first anesthetic we are going to use is lidocaine. Lidocaine is a short-acting anesthetic, but it causes less discomfort when injected. We're going to inject at the plantar fascia bone interface. The reason we use lidocaine first is to provide pain relief when we give the injection. Some people don't do this, but we truly believe that this is the very best way to go since people have less discomfort with the procedure. We use a cold spray before we do the local anesthetic injection to decrease pain from the injection. The next thing we're going to do is an ultrasound-guided steroid injection. We use a combination of Marcaine, which is a long-acting anesthetic, along with Depomedrol, which is a medium-acting steroid. We don't like to use a strong steroid such as Kenalog, since this has a complication including rupture of the plantar fascia and decrease in the fat pad. The next thing we do is find the plantar fascia bone interface. Here you can see the needle, the bone, and this is the plantar fascia. The fascia bone junction is the location where we want to place the steroid. The next thing we want to do is puncture the fascia multiple times. The theory is you place the fascia back into an inflammatory phase. The body sees this as an acute reaction and goes on to heal the plantar fascia. Again, the theory with dry needling is that we are trying to stimulate the plantar fascia to go back into a self-healing phase. The body then recognizes this as an acute problem and goes on to heal the plantar fascia. The last step is to recommend the appropriate orthotic for your foot type. The orthotic is used to take pressure off the plantar fascia by placing pressure into the arch. Without an orthotic, you are not alleviating the forces causing the condition. In summary, we use the ultrasound to mark out the fascia and inject local anesthetic. After the area is anesthetized, the heel is injected with steroid. Then needle the fascia to trigger self-healing. The last thing to do is provide the patient with a correct orthotic. If you have any further questions regarding this or any other foot condition, go to footankle.com. If you're interested in our shoe list, go to the main page. At the bottom, you can input your email address. Thanks for watching.